then please just call me Ellen.
Okay, gotcha. All right, great. Well, welcome to the show. Thank you so much for being here.
Thank you, Elisa. It's really good to be here.
So, I have been reading and hearing a lot, especially since the pandemic, about the rise of anxiety, especially in adolescents, girls in particular. We've talked about that before on the show. Can you talk first? Introduce yourself, and then we're going to talk a little bit more about what inspired you to write your book.
Sure. Yeah. So I'm a holistic psychiatrist, which isn't really a household term. So you could think of me as a weird psychiatrist. I went through medical school and psychiatry residency, and I came away from that decade of my life deeply disenchanted with how conventional medicine addresses mental health. I felt like we had a lot of room for improvement. So I've gone on to study other disciplines like Chinese medicine and acupuncture, Ayurveda, functional medicine, psychedelics, nutrition, and that all informs everything I do with patients. I'm always meeting an individual and thinking, how are they out of balance? How can I help them reclaim a state of balance so that they can lead a fulfilling life? And I decided to write this book for two main reasons. And one is that I was just seeing the scale of this problem that every patient coming into my office was struggling to some extent with anxiety. And it felt like this vast, you know, problem, so much need. And I was just one person with a small private practice, and there just needed to be a different conversation about it. The other reason is that I sort of get excited about the idea of treating anxiety. Like there are certainly conditions that I'm not that excited about treating. Some things I'm like, oh boy, here we go. But anxiety is, there's a lot of low hanging fruit. There are a lot of quick wins to be had. And little strategic shifts in diet and lifestyle can relieve a lot of unnecessary suffering. And so I just chomp at the bit at an opportunity to help somebody with their anxiety. And those are the real reasons I wrote the book.
Okay, well, there's so much in there that I want to ask you about. So, can we start first with, can you explain what is anxiety, just to so people understand it? And I don't know if there's like a definition that you can share, but also what does it look like?
Yeah. So I have such an irritating answer to that question. I so avoid the definition. I do think it manifests a little differently in all of us. Typically, it's, kind of an exaggerated state of anticipating a negative consequence, being, uncomfortable with uncertainty, being in a state of fear or worry, future tripping. But there are people for whom it presents as chronic, constant state of worrying and muscle tension and never being able to relax. For other people, they can come back to a pretty normal baseline, and then out of the blue, they'll have a panic attack. And for others, it's social anxiety. And for others, anxiety also includes things like PTSD and OCD. And so it really does show up in different ways for all of us. And I find that people have no problem identifying with anxiety, sort of subjectively calling what they're feeling anxiety. And so if what you're feeling is something you subjectively identify as anxiety, in my book, come on in for the conversation. It's all valid forms of anxiety, and we can help all of it.
You mentioned before that some simple things that people can think about as it relates to diet can also is very much linked to it. So makes me think that it's linked to anxiety. Can you talk about how diet might be linked to anxiety?
Yeah, we have to go deep and nuanced right off the bat then. So the whole conversation about food and anxiety, it's fraught. And on the one hand, the brain is this piece of flesh. It's a physical organ like any other part of the body, and it requires certain raw materials to function properly. It requires vitamins and minerals. We get that from our food. And we happen to live in a food environment that does not make it easy for us to get the nutrition that we need. So we're fighting an uphill battle. And I do think that I like to empower people with the knowledge of here's how you nourish your brain. Here's how you get the vitamins and minerals that are going to support your ability to have healthy neurotransmitter function and feel well. And here's how to avoid the foods that are really shooting ourselves in the foot, things that are inflammatory, things that we might not tolerate, might be causing damage to our gut health. And so there is a lot of power in knowing how to navigate the available foods in a way that nourishes us and doesn't irritate our system. That said,
Mm-hmm.
because our world makes it so hard to eat well, and
Mm-hmm.
because so many of the foods that are defeating to our mental health are somewhat addictive, are ubiquitous, are our comfort foods, then we get into a whole other conversation about food, which is how to nourish ourselves from a place of self-love, not deprivation, not negation, not self-loathing. And
Mm-hmm.
how do we do that without becoming obsessed and fixated, and where it starts to take over our life and become a part-time job and we start declining social connection? And that is where it gets really hard, because once we start being obsessive about how to eat right, which is
Mm-hmm.
also called orthorexia, that's not helping anybody's anxiety. That's
Right.
contributing to anxiety.
Yeah.
So it's a very delicate balance to strike. I do my best to really present both sides of that argument in the book. And it's tricky, but I think at the very least, can we drown out the noise about the fact that this has to do with vanity? I don't think it has to do with vanity. It has to do with how we feel and whether our health can be the foundation for us to lead a fulfilling life,
Mm-hmm.
and to not feel like we also need to eat like a teenager as an act of rebellion against toxic diet culture and wellness culture, because then we're really just rebelling against that, but taking it out on ourselves. And so I think that there's just ways to reclaim a relationship to food that is full of ease and pleasure, but also really giving ourselves the juicy nutrition we need to feel good.
Yeah. Well, I want to ask you a little bit further on this question about diet and issues with food as it relates to anxiety, because on this show we've talked before. We had Dr. Lisa Demora on the show, and she talked about how the with adolescent girls in particular, one of the ways that their anxiety manifests is in this huge increase that she's been seeing and others have been noting in eating disorders amongst adolescents. Can you talk about that a little bit?
So I will say I have a somewhat unorthodox view on what's happening with eating disorders. I think everything that we all culturally already believe is true, like our societal pressures, comparisonitis, the fact that life can feel so out of control for women, and our food and our eating can feel like one way that we're exerting control over our lives. I think
Mhm,
all of this is true. You know,
mhm,
what the images we see on magazine covers, it all plays into it. But I will add that, at least in my own life, there was this other factor that contributed to disordered eating that I think doesn't get discussed
mhm,
yet. And it's really vital. Um, I think that you could say that eating disorder behavior starts when we start to restrict. And that sort of starts the cycle of restriction. And then the body becomes obsessed with food. And then there's binging. And then there's compensatory behaviors and restriction, and so on and so forth. But I actually think something precedes the restriction, and that is an out of control relationship to food that is actually itself caused by the nature of our processed foods. So I
mm,
think modern day food or processed foods, whether it's the opiate like quality of gluten and dairy, or the excitatory quality of things like MSG and whatever flavor crystals they spray on processed foods to make them addictive,
mm,
and just to that sort of dopaminergic rewarding quality of sugar.
mm,
So many of our processed foods behave like drugs.
mm,
And, you know, the Pringles slogan, I bet you can't eat just one. The joke is on us. We
mhm,
can't. We literally
mhm,
cannot, because they're addictive. And I found for me that I was only ever interested in restricting because I couldn't achieve satiety.
mm,
I couldn't eat and feel an experience of being full. I look
mhm,
back now and I realize there were definitely psychospiritual components to that. I was lonely. I was unmoored. I was unsure of my path. There was so much that was like a hole that I was filling with this drug addiction. But
mhm,
that processed foods played a role of really distorting and dysregulating my body's ability to have an appetite and feel hungry, and then to feel full. And that feeling of being unmoored from when am I full and how am I in relationship to food, I think that was also a precipitant for restriction. And
mhm,
so, with this rise in eating disorder, one really nice actionable entry point is to look at the foods and kind of think about it almost in an abstinence-based recovery way, where you
Mhm.
don't have to avoid all food, of course, but to
Mhm.
avoid the drug-like foods can sometimes be an exit ramp from that cycle of restriction and binging.
Mhm. So your feeling is that a lot of what we are dealing with now, this rise of eating disorders, has to do with not just maybe the anxiety, the increased anxiety, but the actual addiction that we feel towards these foods because of how they're made.
Yeah, I think it's both. I think it's
Mhm.
absolutely both. I think it's a multifaceted and enormous problem. And I think
Mhm.
that young people are under so much pressure, females in particular. Social
Mhm.
media has not helped. The pandemic
Mhm.
has not helped. Zoom
Mhm.
school has not helped. There's so many pressures and so little that's filling their cup and letting them feel grounded and accepted and a sense of belonging and a feeling of a connection to physical activity and nature and all the ways that humans have these needs. And I think kids have all these unmet needs, all these pressures. And then when you add on to that the fact that modern life is bathing them in a chemical stew and all the way down to the foods, I think it makes it really hard to um, feel a state of physiologic balance and health. And that can trip people into a really disordered relationship with food.
So thinking about anxiety over, as just the focus area for a moment, is you had mentioned before that you studied sort of more traditional, you went to medical school in the United States, a very good medical school in the United States, and practiced, but felt that there was something missing from the way that we were treating people from a medical standpoint, and decided that you wanted to add something more to that. Can you talk about what you've added and what you think it means for how people should be treated from medical moving forward?
Yeah, and I think you say it very generously to say that I thought that there was something more that was needed. I think in certain ways, not only were we not doing everything that was needed, but sometimes I think we even do cause harm in our
Mhm.
conventional approaches to mental health. So, the insight that I got was like actually the insight came at an unexpected moment, not in my psychiatry rotation, but it was actually when I was on my surgery rotation and we were
Mm.
standing over an appendectomy. So someone
Mhm.
was having their appendix removed. And
Mhm.
here I am. I'm this like, you know, Jewish New Yorker who's destined to become a psychiatrist. I'm interested in the question why
Mm.
and how. And in the OR, there's sort of a radio playing. The surgeons are sort of shooting the shit, if I can pardon my French,
Mhm.
and they're basically just talking while they're doing this operation.
Yeah.
And so I thought, this guy is probably given this a lot of thought. I would love to pick his brain and understand what he thinks about appendicitis. So I was like, what do you think causes appendicitis? And he shoots me this glare and he's like, what? We don't ask why, we just cut. And I worried, it started to dawn on me that that's actually an illustration of a lot of what's wrong with allopathic medicine is we
Mhm.
don't ask why, we just cut, or we don't ask why,
Mhm.
we just medicate. We basically
Mhm.
accept this is the way things are. Things have
Mm.
gone wrong in the body, it's broken,
Mm.
but
Mhm.
there's something we can do about it. And to be honest, when something goes really wrong, I'm so grateful for conventional medicine. I love that we have conventional medicine to handle a heart attack, to handle a car accident, to handle cancer. I think where we have to be discerning is that it's pretty lousy at prevention and it's
Mm.
pretty lousy at these more amorphous chronic degenerative diseases of chronic inflammation. What's the
Mhm.
lion's share of the ways that we're suffering? And
Mm.
that's where just cutting or just medicating is actually not a solution at all. We need to go upstream and we need to ask, why is this happening and what can be done? So, what I learned when I went to other disciplines is that they're all about the why. They're all about prevention. Chinese medicine, Ayurveda, they've been thinking about the balance in the body for millennia. And we are just, there's something very young and naive about allopathic medicine in the West right now.
Mhm.
And so, what I learned is that we need to take the whole portrait of a person's life into consideration. We can't just
Mhm.
think of mental health from the neck up. We can't just think about it as a chemical imbalance that's genetically determined. So, it's just a destiny and there's nothing to be done except for meds and therapy. We have to think about this as a human being with needs, with a digestive tract that is in constant communication with their brain, maybe with inflammatory molecules in their bloodstream. Maybe they're malnourished. Maybe there's a thyroid condition. Maybe they're on their phone until midnight every night and never getting a full night's sleep. Maybe they're on social media feeling bullied, feeling ostracized. We need to think about all of this. These are all determinants of mental health. And so that's what I learned by going outside of allopathic medicine.
So can you talk a little bit about what are misconceptions about anxiety? Am I alone in feeling like we are talking about it as if it's negative and we have to stop it?
I love this. My mind is going in 50 different directions. Let me see if I can shore up those pieces. So one thing is mental health, for all of its failings, we actually do have this one useful gatekeep, which is that according to the Bible of mental health, the DSM, it's important that no one really qualifies for a diagnosis unless the constellation of symptoms that they're experiencing is causing distress. It's causing suffering sufficiently that it's impacting the quality of their life, their ability to go about their day. And so, if you're having a positive association with that sort of revved up, engaged, motivated feeling, you wouldn't qualify for a diagnosis. And that's probably for the best.
Mhm.
But I think that the way I think about anxiety is when someone comes to me and they're struggling with anxiety, so they're already telling me, I'm suffering. I don't want to feel this way anymore. Let's break it into kind of three categories. One is what I call false anxiety, which we can go more into, but it's basically this avoidable anxiety. It's a physically based anxiety where something has tripped the body into a stress response that's tracking up to the brain and making the brain say, I'm anxious. But it's not some deep inner truth. It's just a blood sugar crash or sleep deprivation or inflammation in the gut. And so that has a straightforward path out. And I really like to eliminate that kind of anxiety from somebody's life. I don't see that as serving them in any way. It's causing unnecessary suffering. Then there's the anxiety, which is sort of like all the perfectionism and fear and anticipating negative consequences. And, all of that, it's hardwired in our DNA because it's the reason our ancestors survived. The ability to think in a scenario, to not just like walk through life blundering, but to be like, that rustle in the leaves might be a leopard. Let me think about whether it's a leopard or not. I'm not here to dispute the value of that. Like, we need certain degree of fear to keep us alive. Maybe it just doesn't need quite as much airtime as it gets for some of us. But the third piece of this is what I call true anxiety, which is purposeful anxiety. It's not something that we should be pathologizing. It's not something we should attempt to medicate away. We couldn't decaf coffee or gluten-free our way out of it if we tried. It's our inner compass. It's here to tell us, slow down, pay attention. Something is not right here in our personal lives, in our communities, in the world at large. And it's nudging us. It's saying, you have a unique perspective or a contribution to make. No pressure, but please take action and take some steps accordingly. And sometimes we avoid that truth. Sometimes it can feel like it will blow up our life. Sometimes we don't feel worthy of the calling, whatever the case is. But I think that we don't want to pathologize that. And often it's actually, this has become somewhat of a cliche at this point, but I do think that kind of anxiety is a superpower. These are the sensitive, attuned, intuitive people who are like, there is something very wrong somewhere, and I am attuned to it. And I want to take action to take some steps to help right this wrong, to course correct our society. And I stand in gratitude to the folks on this planet who bring that kind of anxiety. And I don't want them to shame themselves. I don't want anybody telling them, don't be so sensitive. I want us all to slow down and listen to what they have to say.
And I think the reason that resonated with me was because in my life, when I got to a point where I physically felt like, oh my gosh, I can't accept how uncomfortable I am. Wait a second, maybe I need to do something different. It's telling me to do something different. I know this is a little meandering, but does this resonate at all in terms of what you're saying about this discomfort, which I associate a little bit with anxiety, um,
Yes.
and that being a cue for us? So when you said before, superpower, use your anxiety as a you can use anxiety as a superpower. Is that what you mean?
Oh, I mean, I have goosebumps thinking about this analogy. I think it's a perfect analogy for this. I have so many patients who their true anxiety feels like a tight shell. It's
Mm,
basically they've outgrown a relationship, a friendship, a job, a career path, a city, and it feels really inconvenient to face that truth. It feels really uncomfortable. So we keep going in a status quo that's actually also quite uncomfortable. We stay in a too tight shell just to avoid kind of busting out. And I think that it is helpful for us to recognize that sometimes that true anxiety, as I say in my book, it's like it's not that we need to be saying like, how can I feel less anxious? It's really, what is my anxiety telling me?
mm,
And sometimes that feeling of this life is feeling too tight is a call to action, that it's time to bust out and to listen to, here's where you need to go, here's the change you need to make. And I have the utmost compassion. It is scary, it could be terrifying, but I think that we also need to have appropriate fear about living a life where we don't heed that truth.
yeah. Well, and thinking about even the way that we might traditionally resolve that, if we took a medication to, let's say, even us out, whatever it is that you might get if you went maybe just the pure Western medicine route, then you would never feel uncomfortable enough that you could grow. And I guess that it stuck with me what I was saying before about the lobster analogy, because it meant to me that, okay, growth is associated with discomfort and maybe a bit of anxiety, that actually is what propels you forward and helps you grow. Is that a fair assessment?
Absolutely. And you bring up such an important point here about medication. So we should have the proper nuanced discussion about psychiatric medication. It's a sensitive topic. There's a lot
Mhm,
to be said. But
mhm,
on this topic, um, I I had a patient once who he was unhappy in his marriage. They were considering separating. And this was early on in my career. I was still a little bit more like was prescribing medications more readily at the time. And he was really meeting all the criteria for depression. And we decided together to put him on Lexapro.
mhm,
And in ostensibly, it was a great success. His symptoms got under control. He really was doing well. He was sort of back to performing better in his work. He was tolerating his marriage. It was sort of like success story. Good job, Dr. Vora. And at the time, I think I was Dr. Goldstein. This was a long time ago. And but basically, I can't remember the details of how it all came to pass, but in the end, he did end up getting off of his medication, and he did end up separating from his partner. And he came back to me, and it wasn't like accusatory, but he was like, I think you should know that even though that medication worked, it was the worst decision I ever made. And he's like, it put off me making necessary changes and really starting my life by, I think it was like 4 years. And in his case, what we did was we made the wrong situation tolerable. And I think sometimes we see that with meds. I sometimes wonder if, I don't dispute the very real and genetic basis to the neurodivergence that we call ADHD, but I also see the pressures that a lot of people in a place like New York City, where I practice, where people are under, where they kind of feel like they need to be Superman at work. And so they take stimulants to perform superhuman amounts of work every day. And what we're doing again is making an intolerable situation tolerable with medication. And so I'm sort of more hesitant to support that in my practice, especially after that. Um, what I've learned from working with that gentleman who really kind of was like, this worked and it was a terrible decision.
yeah. It occurs to me as we're talking that a critical element of a process of determining what to do about your anxiety if you're feeling like you are suffering from anxiety, and so I use the word suffering to speak to what you said before, that you just don't want to have this, that you don't want to function this way. I wonder how important is a practice of self-awareness, like understanding and people have being able to look inward and really understand what's going on with themselves, in addition of course to speaking with someone that can maybe help them with this. But self-awareness seems to be a theme that we hear about a lot from women. Our community tells us that they struggle by that on average, people seem to struggle with feeling like they understand why things are going on with them. They might have the feeling, I'm happy, I'm sad, whatever the feeling is, but they don't have insight into why. So can you talk a little bit about self-awareness and its role in understanding your anxiety, uh, to really know which path, which part of the like, is it a good anxiety, or it could be a useful anxiety, or is this the anxiety that is not useful in your life?
Yeah, great question. Yeah, I think that, and I don't necessarily think men excel at self-awareness either. It's a different problem over there, but I
We're
am,
women and maybe are self-aware enough to know that they don't excel at self-awareness.
I am far more intimately acquainted with the ways that women struggle with this. So, um, I think that, this for me, anything I'm about to say rests on the shoulders of giants like Glennon Doyle with her book Untamed, and the Nagoski sisters, Emily and Amelia Nagoski, their book Burnout. I think they've really set the stage for this conversation where they've recognized that women, we don't get to be human beings. We're human doings. We're sort of always in service of others. And it's our conditioning throughout our lives to basically suppress and silence and betray our own needs, because what's expected of us is that we smile, that we say yes, that we are in service. And if we don't, we'll be ostracized by men and women alike for being selfish, which is such a slander for a female. And I think that the tricky thing is that, and this is really, it gets kind of meta and trippy at a certain point in this conversation. The trippy thing is that if our whole goal is actually this very pro-social, empathetic choice, which is to be oriented towards others and to be of service. And I call that goal into question. But even if we're going to say that is our goal, what happens is when we betray our own needs systematically throughout our lives, just to be in service of others all the time, inevitably we burn out. And then we become this pit of needs, this black hole of unmet needs. And suddenly then we want to obligate other people into meeting our needs. We are passive aggressive because we've felt disenfranchised our whole life to ask for our needs. And we really don't help others once we get to that state of burnout. And so that's like a really bad combo that you see play out over and over again with women. It's I sacrifice, I sacrifice, I sacrifice. I'm super burned out. And look, I gave so much to you. Now you need to give to me. And I prefer a world in which we give when we're able to give joyfully and sustainably. And then when we recognize that we're getting to our limits energetically, when we're pouring from an empty cup, we say, oh, hold up, I have an energetic limit here and I need to pause. I'd love to help you, but I can't right now because I need to keep myself intact. And to recognize that we are worthy of being intact. But if women who have been conditioned their whole lives to be in service of others, if you need to be sort of convinced with an argument about how to be oriented towards others, if for no other reason than the fact that we're not in service of others if we sacrifice so much that we burn out. And so I think it's really important for us to just recognize our own needs and to actually advocate for them and see ourselves as worthy of having our needs met every step of the way through our lives. And it does start with a recognition of the conditioning we've had, and to also recognize that it's BS. And so we need to kind of wake up to that and then do the very uncomfortable work of saying, here's my limit. I'm going to say no to something. And people will protest. And that's not a reason for us to second guess ourselves. It's for us to understand they might have been feeling entitled to something that was never theirs to begin with. And that's why they're protesting our no. And so I think the conversation that's coming down the pipeline right now is all about boundaries. And I think it's a really good shift. I'm really here for that movement.
So, do you have any tips or advice for women who are wanting to get more in touch with what's going on? Is there a practice? Is there some sort of practice they can start to today when they hear this? start to do today to help them become more aware of what is going on within them?
Yeah. So it isn't a one size fits all thing. It's really, we all have to find the one that feels right for us. But there's an overarching principle of mindfulness to pretty much any practice that's going to help increase our self awareness. And what is mindfulness? It's paying attention in a particular way on purpose. So if that looks like 20 minutes of meditation for you, great. If it just looks like you kind of pressing time out throughout your day to be like, whoa, what's happening? I'm triggered. Why am I triggered? I'm triggered because this person said this thing and it reminds me of how my cousin used to bully me. And so now, no fault of this person, I'm super triggered and round up and I want to fight them, or I want to shut down, or I want to flee. Basically, we just need to start pressing time out. So it's like, I'm feeling a certain kind of way and why. And I think any version of slowing down and connecting to stillness, that can be in meditation, that can be in nature, it could be taking an unplugged walk, it can be sitting in your living room and staring out the window and doing absolutely nothing, just a blank stare on your face. But it's stillness and silence, and I think that's where we reconnect to how we feel. I personally do a shaking practice, and I really like this. I put on shamanic drum music and I shake. And what that does, I think it does a number of different things, but I make sure I move the way my body wants to move. And that itself is an art form, tuning into that, because we have so much conditioning that says, move this way, that looks cool. Don't move that way, that looks ridiculous. And to let your body move the way it feels like moving is a really healthy rehabilitation of all the ways we silence and betray our bodily needs.
Yeah. Wow. I love that. And
Mhm.
well, Dr. Ellen Vora, I learned so much from this conversation, and the anatomy of anxiety. I cannot wait for people to dive into it. But you also talk more about, you have a way that people can follow you and learn more about what you're doing. What is the best way for people to do that?
I'm most active on Instagram. I'm at Ellen Vora MD, and my website is ellenvora.com.
Thank you. I so appreciate you spending the time with us today. Hopefully, we will get lots of people additional, a new perspective on anxiety and things that they can do
Yeah.
to investigate it further.
Lisa, thank you for what you do, and thanks for a really great conversation.